Hello, everyone. My name is Jayant Siva, and I'm a researcher at the Cleveland Clinic. Today, I want to talk about a question that a lot of men, and honestly, a lot of couples are starting to ask. If I take ADHD medications like Adderall, could that affect my fertility? This question is becoming more and more important because millions of men are now taking stimulant medications during their reproductive years, often at the exact time that they're thinking about starting a family. To answer this, we conducted a large multi-center study looking at over 2,000 men between the ages of 18 and 40 with ADHD. We compared men who were actively taking these medications like Adderall to similar men with ADHD who were not taking these medications. Importantly, we carefully excluded men with other conditions or medications that we already know could affect fertility, so we could isolate the effect of the stimulants themselves. Here's the key takeaway. Men taking stimulants had a slightly lower volume of their ejaculate, about an 8% decrease on average. But more importantly, there were no differences in their sperm count, their sperm concentration, or their sperm motility. When people hear a reduced volume of their ejaculate, it can sound very scary. But in practical terms, the difference that we saw was very minimal, about a quarter of a milliliter. And more importantly, fertility is driven much more by how many healthy sperm are actually present, not just the volume of fluid. So if sperm count and motility are normal, which they were in this case, that's very reassuring to see. Another natural concern is whether that small decrease in semen volume could still decrease their chances of pregnancy. Based on what we saw, that's very unlikely. Even though the volume was slightly lower, it didn't translate into fewer sperm or worse sperm movement. And those are the factors that actually determine whether fertilization can happen. We also didn't see an increase in clinically low semen volume, meaning that this wasn't pushing men into abnormal ranges. So biologically, there's no strong signal that this small change would meaningfully reduce fertility. We also explored why this might be happening. And interestingly, it doesn't seem to be affecting sperm production itself. Instead, it may be related to things like fluid production from accessory glands or even indirect effects like hydration, since stimulant medications can reduce appetite and fluid intake. So this appears to be more of a functional or physiological effect, rather than damage to your reproductive system. So for men who are on ADHD medications and thinking about having children, this is generally very reassuring. We did not find any evidence that stimulant use negatively impacts sperm production or function, which are the key drivers of your fertility. That means for most men, continuing these medications is unlikely to significantly alter or affect their chances of conceiving. Of course, individual situations can always vary, and if someone is actively dealing with infertility, it's always reasonable to talk through these medications with their doctor. But at a population level, our findings suggest that this is not something that most patients need to be actively worried about. And that's a very important message, because managing ADHD effectively is also a critical part of overall health and quality of life.